Hello, everybody. This is Mr. Anderson, and on today's podcast,
Stop. You are not Mr. Anderson. For the last time.
but but I mean, I
But
could.
you're not. Now let's take this from the top, people. Take two.
Okay, fair enough. Good afternoon, everyone. I am Adonijah Thomas, a student at the University of Maryland, and this is my human biology class taught by Professor Ellie Herrera, due 1 July 2025. And today, we'll be going over Alzheimer's disease. Let's get into it. So, what is AD? From the National Institute of Aging, Alzheimer's disease is the most common form of dementia, a brain disorder that slowly destroys a person's memory and thinking skills. It is characterized by a loss of cognitive functioning, thinking, remembering, and reasoning, and behavioral abilities to such an extent that it interferes with a person's daily life and activities. So, what are the signs and symptoms of AD, you ask? So, memory loss is a common sign of Alzheimer's disease, AD. A short term memory is a symptom, and this can include forgetting of important dates and increased use of tools like calendars or other memory aids such as reminders just to keep track of daily tasks. Then we go on to planning and problem solving challenges. Those with AD may experience difficulties in their ability to develop, follow a plan to work with. They also may have difficulties with following numbers. An example of this is a family cooking recipe that in the past was very easy for them to continue. However, due to their now disease, they have trouble following on. There's also speech difficulties. This can include forgetting to recall certain words or forgetting how to pronounce others. Then there's the impaired judgment. A lapse of judgment is another symptom of AD. This can make those who have AD more susceptible to scams. Then there's confusion. Those with AD have trouble keeping up with time. This can include seasons and significant dates. This could even go as far as forgetting to where they are at any given moment. Let's move on. So, what are risk factors of AD? So, the number one misregarded risk factor for AD is simply old age. Father Time catches up with you one way or another, and sometime it catches up with you in the form of Alzheimer's disease. Then we have alcohol abuse. Excessive alcohol consumption throughout one's life can lead to increased chances of AD later on. Then we have genetics. Those with a family history of AD are more likely to develop it themselves. For example, if your father, your mother, your grandmother, grandfather, and down the line, if those people may have it, it increases your chances of having it yourself in your time. Then there's diet. Having a predominantly unhealthy diet, high in saturated fats, sugar, and salt, can increase the likelihood of developing AD. Physiological changes. So, what's going on in the brain exactly? So, AD is essentially the abnormal buildup of protein deposits, specifically amyloid plaques and tau tangles. But what does this mean? These buildups disrupt the normal functioning of neurons. This causes decline in memory, thinking, language skills, and struggles with daily tasks. Tools and diagnostic tests. What kind of tools and tests do we have to diagnose AD? So, just to be frank, there is no one size fits all for this. There is no single test that can determine if a person has Alzheimer's disease. Physicians use diagnostic tools and various information methods to gather and successfully diagnose someone with Alzheimer's disease. Medical history is a big part of it. A healthcare provider will likely review your psychiatric history, a history of cognitive and behavioral changes, current or past medical problems and or concerns, any medications, key medical conditions affecting other family members, including but not limited to AD or other dementias. Physical exams and diagnostic tests. Medical providers will likely want to know the following information: diet, nutrition, use of alcohol, medication review, blood pressure, temperature pulse, heart and lung checks, blood and urine samples, and a neurological exam. Brain imaging. Structural imaging with magnetic resonance, MRIs, computed tomography, CT. Doing this rules out other conditions that cause similar symptoms to AD, i.e., a brain tumor could cause someone to have a memory lapse, and a scan such as a CT or an MRI can conclude that, and therefore conclude that Alzheimer's disease isn't the cause of the problem. How can we prevent it? Preventative measures include physical fitness from regular exercise, moderate to vigorous aerobic exercise, improved blood flow to the brain. Mental stimulation, keeping an active mind, especially in old age, from reading, trying to learn a new language, playing musical instruments, or an occasional game of checkers or chess. A healthy diet, balanced diet rich in fruits and vegetables, whole grains, and healthy fats. Limiting saturated fats, sugars, and processed foods. And the word cited page. So, I hope you all learned something. Thank you for watching.